Hi, and welcome back to Body Beautiful. We are here with plastic surgeon Dr. Joseph Mealy talking about a bunch of procedures. I'm Janelle Marie. Now, if you want more information on anything you see here today, call the office at 925-943-6353, or you can see all the before and after pictures at drmealy.com or sanfranciscobreast.com. Dr. Mealy, again, welcome back.
So good to be here.
We are talking about mommy makeovers, and those are very, very popular. Now, who needs a mommy makeover?
Well, it's called mommy makeover because it's something that is very popular after having children.
Absolutely.
Because the children, it affect the belly and the breast, which are the two areas it addresses.
I love that. Let's talk about the pictures because everybody wants to see the before and after, especially the mommy makeover. Let's talk about picture number one.
So this is a young woman who had children. She was concerned about the deflation of her breasts and the fullness in her lower belly because she's used to having a very flat stomach, as well as the stretch marks in the lower part of the abdomen. So in this case, we've used an implant to increase the size of the breast and then did a tummy tuck to flatten the belly and to remove a lot of the skin on the lower abdomen to get rid of a lot of those stretch marks.
Yeah, can you get rid of the stretch marks, most of them, with that?
Well, physically we're removing the skin that has the stretch marks in it, so that allows me to remove them. But there's always, if there's some above the belly button, if there's some off to the side, some of those get left behind, but they usually end up flatter and smoother.
Now also very natural, of course, the before and after. Is it popular to do the fat grafting with a mommy makeover? Let's say if somebody needs a little fullness in their backside?
Sometimes. It just makes the recovery a little tough because now we've beat them up front and back and sides and top and bottom. So it does make it harder.
Let's go to picture number two and talk about that recovery time. Let's say somebody is having the full-on mommy makeover like picture number two. What is your recovery time here?
So the recovery, most of this is from the discomfort of the breast and the belly. So when we do a tummy tuck, it tightens the rectus abdominis muscle, which is the muscle that tightens as we increase our posture as we move.
Gotcha.
So the hard part is getting up. So getting up from laying down and from sitting for the first couple of days is hard. By the end of the week, though, most people are up and moving. And I find my patients who get up more quickly tend to heal more quickly because their body gets used to the new position, it gets used to the tightness in the abdomen after the surgery, and they just get back to normal quicker.
Picture number two is beautiful. I mean, everything, you've got the breast nice and full again, and most of the...
her proportions from stomach to breast were kind of backwards. The belly's sticking out more than the breast. Not everyone's ideal. So the plan was to increase the bust size to give it more projection, but also get rid of that extra skin that hangs over at the bottom of the belly.
And if somebody, in childbearing has their child, when you do the kind of corset, right? You tighten the stomach muscles so that it just looks better all around.
Yeah, it tightens right up and down the middle. It's under the skin, so you don't see it from the outside. But basically, it's taking the two sides and bringing them towards the middle, which also helps with the waist. So it flattens in front of you on the side view, but also brings the waist in when we're looking at someone from the front.
Picture number three, what's going on here?
So same idea. We're trying to get rid of skin that's excessive on the belly and get rid of the sort of ptosis, the little bit of sagging that's present on the breast. And again, she's pretty close to where she wants to be. So haven't had to use a really large implant or done anything dramatic there.
Looks
just
great.
Giving her back the proportions that match the skin that she already has. And for the belly, her whole torso is now narrower. You can kind of see everything get pushed forward as the muscle separates with pregnancy. And repairing that muscle is really what gives her back her tone.
And the final picture?
And the final one, same idea. We've got someone who had a tummy tuck prior, and now she'd lost weight. So what we've done is a lift with an augmentation. And then on the belly, you can't see as dramatic a change because a lot of that skin was removed the first time, but the area above the pubis was quite full and noticeable in dresses and pants. So we're able to tighten that up and redo her scar.
Do you have to wear a lot of... do you have them wear drains afterwards? What kind of thing after the surgery?
I do. I tend to find the drains speed up the recovery, so I still like to use the drains. They're in about a week, which is not too inconvenient.
That's not bad.
But it does help speed up gets rid of the swelling, helps the belly flatten out faster.
All right, sounds wonderful. Remember, if you want to see any more of these before and after pictures, go to drmealy.com or sanfranciscobreast.com. And if you want to call the office, Dr. Mealy's office in Walnut Creek, just give them a call at 925-943-6353. We will be back with lots more on Body Beautiful.